This video is a full breakdown of a radial nerve entrapment. I cover the following. Why do nerve entrapments occur? Signs and symptoms of nerve entrapments, common locations of radial nerve entrapments, and successful treatment process and case management for long-lasting pain relief. For those of you who don't know me, my name is Dr. Matt Maggio, and I am a non-surgical expert in chronic pain treatment. My focus is on finding and fixing nerves that become stuck to muscles with a glue-like substance called adhesion, also known as scar tissue, and reducing inflammation from chronic pain naturally without the use of medications or injections. This leads to a significant increase in flexibility, function, and long lasting pain relief. I'm also the creator of the Peak Method, where we teach overworked massage therapists a new treatment system that cuts session times in half and eliminates the frustration of inconsistent results so they can avoid burnout and help more people get out of pain. All right, radial nerve entrapments. I love nerve entrapments. They're my favorite things to treat, my favorite videos to make. So, clinical presentations and long lasting treatment processes of a radial nerve entrapment. A couple of common injuries you're going to see with this, as well as maybe going to be something maybe in the triceps, or even a client that might present with like a tennis elbow or something like that. But we're going to break that down a little more in depth in the video. So, first off, is just nerve entrapments. What are they and how do they form? So, usually, what happens over time is areas and around the muscles, the joints, and especially the ligaments, they get overstretched. And when they get overstretched, they're constantly contracting. They don't get enough blood flow, they don't get enough oxygen. And the body starts to think there's an injury there. So it starts to lay down this stuff called adhesion, also known as scar tissue. It's basically just like immature collagen fibers, and the body sends it out there to try to help because something's going on. It doesn't really know. So a lot of people think when they get scar tissue, they just have to have a direct injury. But more than 90% is just from overuse, repetitive stuff. So it starts in the ligaments. Now the force can't generate how it's supposed to. Then it goes into the muscles and the surrounding fascia. And when it gets inside those areas, it makes it weaker, less flexible. Then eventually the nerve gets stuck to the muscles and the fascial um, adhesion. So nerves are built with about 15% of extra slack to kind of keep them moving and keep them healthy. But over time, as that adhesion gets bigger and bigger, eventually it gets stuck to the nerve. And a lot of times people are feeling things like down the arm, into the hand, into the wrist. A lot of times it's coming from higher up in the chain because it's getting, basically just pinched off because that adhesion is stuck there. So, signs and symptoms of a nerve entrapment. There's three stages that I see. Usually in the early stage, it's going to just be like some intermittent numbness, maybe a little bit of aching, a little bit of burning, and some minor tension. Like nothing that they're going to like notice that much, not enough to like make an appointment and come in and see you as a provider. But they're like, yeah, I feel a little tingle when I first get up, or if I've been sitting for too long, I feel that, but nothing too bad. They can shake it out and it feels better. So nothing that's going to get their attention. Now, second stage is when it does become a little bit more problematic. One thing you'll start to see is some postural changes. So the body has like a hierarchy of how it wants to protect things, and if the nervous system is compromised and there's a nerve entrapment, it's going to alter things. Your shoulder might roll forward, your arm might tilt down to the side. There's going to be a lot more increased tension and localized tension as well, because now when that nerve is getting compromised more and more, it's going to create more tug and pull in that area. And then those muscles are going to constantly contract as well and engage in what I call protective tension to try to ease the area. And then that also creates more inflammation. So now they're starting to notice that a heck of a lot more. This might be a time when a client makes an appointment to see you because they're starting to actually notice those symptoms a lot more. Now, third stage is when it gets really bad. They get extreme pain. There's extreme inflammation. And then what happens over time is when the muscles, the nerves, the fascia, the ligaments are loaded up with adhesion, and the client is still putting force into the area, the force has to go somewhere. So then it ends up going to the tendon, to the cartilage, to the joint, to the bone. And then you start getting bigger things, what I call degeneration, where things just start to break down. And that's when they get a lot of pain, a lot of severe pain. Unfortunately, clients usually wait till it gets really bad at that point, and then we got to undo a lot of things. But those are the stages of the nerve entrapment. So, where does the radial nerve get caught? It gets caught throughout the whole track. And the most common area where I start to find it is going to be down in the lateral elbow in through there. And you can see here, I have an anatomy dissection of it, and it kind of branches off through there. So you have the extensor carpi radialis longus, you have extensor carpi radialis brevis, and then over top of that as well is what is called the supinator. So that's the most common area where it starts to get caught a little bit further down. Those might be your clients that are coming in with like a tennis elbow complaint. Remember, I said a lot of times it's getting caught higher up, and then that area where they're feeling that tension is actually not the true problem, but it's where that nerve is getting pulled a lot more. So a lot of times when you're getting a client that comes in and maybe they didn't have like a direct injury or trauma and their elbow just starts to hurt, you're thinking, hey, this entrapment's occurring somewhere. So the first area is going to get caught lower down, and you're going to see that where they're going to get symptoms is actually going to be into that lateral part of the forearm, classically called tennis elbow. Next area, there's two spots here. So what I have here is an anatomy dissection of the subscapularis, looking at it like right from the front. And there's a couple things that kind of sit through here. Out here where I'm dragging the mouse right now, this is actually called the neurovascular bundle, where things go from here. And the radial nerve is actually this top one here. It's really big, and then it branches off into different sections as well. And then the next area where it does get caught is going to be in through here in the subscapularis as well. So that nerve bundle, which is basically called the brachial plexus, sits there and it starts to pull and tug a little bit more. So that's what you're seeing is it does get caught in the neurovascular bundle, and then it does get caught in the subscapularis as well, a little bit higher up in that brachial plexus. Then the last area, and actually I think this is where most of the problems do begin, is going to be higher up in what is called the nerve roots as they exit through the muscles called the scalenes. You have an anterior scalene, you have a middle scalene, and then basically these nerve roots kind of come out in between, and then it gets caught in between there as well. So it's like a cascade effect. It starts up in the neck and then down into the brachial cords. It has to pull a little bit harder, and then it has to pull a little bit harder as it goes in through the neurovascular bundle. Then it also makes its way down like through the tricep and the brachialis, and then eventually it gets out there into the lateral elbow. They're getting elbow pain, they're having issues. Now they make an appointment, but it's like didn't just happen like overnight, isn't just one specific area. It's like a chain effect as it goes down. So successful treatment process and case management for long lasting pain relief. Number one is like what I like to do is I actually like to start distally and then work my way up to the neck. So maybe on that first visit, the only area I'm going to really be treating is going to be at those extensors, at the supinator as well, maybe a little bit higher up into like the tricep brachialis area. I don't like to treat the whole nerve entrapment in one visit because then I don't know where the worst area is, and then I'm kind of guessing and I'm actually over treating it. And when I'm doing these treatments, nerve entrapments are a little different. What I find with most providers is when they do find them, they're too aggressive with them. You need proper treatment and mechanics as you go in. You want to find where that adhesion is and where that nerve entrapment is, but you don't want to start right on it. You want to go just below it, and you want to get some depth into it. And then you want to back out about 10%, and then you want to tension into that area. That's going to load it up. And then you have the client go through a full active range of motion. That's what actually breaks down that nerve entrapment. You always want to be slow and precise. I find when people treat these nerve entrapments, most of the time they're just way too compressive, and they trap the nerve. It hurts like hell. The client thinks you're doing something. You think you're doing something. All you're really doing is just angering that area. It temporarily feels better, but you didn't actually get rid of the nerve entrapment itself. And then that problem comes right back and you got to start all over again. Next is you got to allow for that tissue to slide properly. So a lot of myofascial release trainings out there, like ART, John Barnes, different types of things. They're actually way too compressive, and they don't account to allow that tissue to slide. If you compress it too much, it doesn't slide. Like I said, it hurts like hell, doesn't actually do anything, just creates like a temporary change where it automatically feels better, but didn't fix anything, and you're right back to where you started. Also, it's not a trigger point. I get people all the time like, oh, I treat trigger points. These are not trigger points. Nerve entrapments and adhesion is an actual physical change in the muscle. The trigger point itself is just like a response to what's happening. So a lot of times trigger points form around the nerve entrapment to try to take that area and that pressure off of there. So you release the trigger point, but now you just expose that area. So it can actually make the problem a lot worse because they do temporarily feel better, but you didn't fix anything, and that's causing a bigger issue. Next here is like getting treatment dosage right. You never want to do more than 3 to 5 passes on this area. I always say treatment's like a medication. You want to do enough to be effective, but you don't want to overtreat. And a lot of times I find providers are just hammering on this area, and it's actually like diminished gains. We want to get just the right amount. I always say stay a little bit lower on the dosage side. Do a treatment, one pass, have them reset and go from there. Don't be in a rush. Just go really slow, very precise, very focused. I say more emphasis on what I call like a sniper approach as opposed to like a shotgun approach where you just treat everything. Sniper approach, we find it, we get it, we're in and out, and then we give the body a chance to heal up. Give them that break in between. These nerve entrapments, they're so loaded up with inflammation. They're tender, they're sore. It's intense for the client as you're treating them. You're treating the nervous system. So just slow down. You don't have to treat a million things in one visit. Treat one or two areas where you find that nerve entrapment and be done with it. It's okay. You don't need to do these long 90-minute, 2-hour sessions and just beat the living hell out of the client. You can actually get a lot done in a shorter amount of time. And lastly is set up properly again for each treatment. A lot of times when people go in there, I always call them almost like technique junkies, or not junkies, like technique monkeys, where they're just like do and they just go 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 go. It's like each time, slow down. Make sure your depth is good. Make sure you back out a little bit. Get that proper tension into that area. Then feel the tissue slide. Then start again, slow down, and not be in a rush. Like really be deliberate, precise, and focused. And you'll be amazed at the amount of change you can actually make in the tissue that's long lasting without doing a ton of like actual physical work. That's all I got in the video. I appreciate you watching. You can share any insights you might have got in the comment sections below. I always try my best to communicate and share knowledge with other people and, get different insights and perspectives. Next is you can do me a solid and share this with other providers out there that it might help. My goal is always to get this care to more people and get more providers doing quality work and helping people though that are in chronic pain actually get some real results. They don't have to resort to pain pills, injections, and surgeries. And lastly, if you like what I'm teaching, you like what I'm sharing, you want to learn more, we do have a full training system. It's completely free where it goes through my system from start to finish, how to take a history, how to do tests, how to do measurements, how to do palpation, how to do treatments. You can really understand this idea that I'm not just teaching you like a technique in some random treatment. I'm actually teaching you a system that gets to the precise problem every single time and gets real and long lasting results. The links to download that are wherever you're consuming this video. I appreciate you watching, and I will catch you on the next one. Bye.